The healthcare system in India is collapsing under the pressure of a surging second coronavirus wave, with hospitals full, patients left untreated for hours, and supplies of oxygen desperately inadequate. The country of 1.4 billion people, the second highest population in the world, now has more daily cases than anywhere else since the pandemic began. It set a global record for 2 days running. In the past 24 hours, it's seen 330,000 new cases. Over 2,000 more people have died in the same period, with severely ill patients being turned away from hospitals which have no more room. India's second wave has accelerated rapidly in just a few weeks to over 3 times its previous peak. Our Delhi correspondent Yogita Limaye, who spent days charting the mounting crisis there, reports now from the emergency ward of one hospital in the capital, and I should warn you that her report contains distressing scenes from the start.
The frontline, an emergency room in a COVID hospital, just about standing under the weight of an unfolding disaster. A patient who's hardly breathing is brought in. As nurses try to get him to respond, there's another person, even more critical. Manjusha Matthew rushes to help. So many like her are putting in all they can. They couldn't revive him. To get past the shortage of beds, they've packed in stretchers, wheelchairs, as many as they can. But the first line of treatment against COVID-19 is oxygen. And they've almost run out. At this point, there is just 1 hour of supply left. The staff knows how many lives hang in the balance. People are being turned away, but they don't know where they'll find oxygen or a bed. Manora Bibi was taken in for a short while to stabilize her. We've already been to 5 hospitals. Where will poor people like us go? Her nephew asks. But this hospital is so on the brink, they have to leave. The intensive care unit is full too. There are next to no ICU beds in a city of 20 million.
These are patients in a critical condition. It's unthinkable, unimaginable that one would think of them as better off in any way. But it's the reality of what we're seeing in India. People in an ICU have won the first battle to be here.
Between seeing his patients, the doctor constantly on calls.
Back up, that's another couple of hours. So we are struggling.
He's desperately trying to get more oxygen.
We are running out of oxygen. The whole country is running out of oxygen, okay? The city is, we are, everybody is, okay? So please focus on that, please. You're doing a fantastic job otherwise, okay? Please. Okay, all of you remember that. If oxygen runs out, there is no leeway for many patients. There is no leeway, they will die.
Day after day, the staff works here, knowing full well that if their families get sick, even they will struggle to find medical care. There is helplessness and anger.
The government in some ways failed in estimating what was going to happen, the needs that would arise if the numbers started rising. There was a sense of preparation in the earlier surge which seemed to have disappeared in between. And they did things which was totally unacceptable, allowing large, huge gatherings, which is totally unacceptable. They believed that we had vanquished the virus.
Some oxygen arrives a bit later, but it can only last a few hours. Then the struggle begins again.
The government says it is trying to speed up the supply of oxygen. Railway trains are being used to carry it around the country. The Air Force has also been pulled in. They're flying empty oxygen tankers to industries that produce the gas so that it reduces the time taken for the oxygen to get to the hospitals that need it. Mobile oxygen production units are also going to be imported from Germany. But this is a crisis that's unfolding right now. Hospitals here running out, having only a few hours of oxygen left. And so many are wondering if this will reach quickly enough to save lives in this city.
Yogita, thank you. Yogita Limaye there reporting from Delhi.